Right, hi, I'm Dave Wieber from Wieber Physical Therapy,
Greg Schroeder, Wieber Physical Therapy.
and we wanted to talk to you today about some of the things we see commonly in hip pathology patients. So people who come in with hip pain, things that aren't feeling well. The two things we see most often are?
Either tightness or weakness, or a combination of both, actually.
Yeah, so we were going to talk to you about the things that we do here at the clinic, and then show you some things that you can do at home. So to start with, I think Greg will start with some what we call myofascial work or soft tissue work to try to loosen up the side of the leg.
Yep.
So you want me facing that way or facing that way?
You can face that one.
All right. All right. Hello?
Pillow.
I'll move that way.
Move that way.
All right.
Roll this up. That's
Yeah, sure.
So generally, IT band runs the length of the leg on the outside of the leg, and that is where our tightness is that we need to address. One of my favorite techniques is just a very gentle, called fascial stretching. And it is just a nice, gentle, sustained pressure that will stretch that IT band.
We find that the glute med and min, the kind of lateral muscles also can be a factor. So many times we'll be working on that soft tissue structure also.
Piriformis, I'm sure people have heard piriformis before. That's included in there.
So we really form an arch from our knee through our sacroiliac joints and then back down to the other knee. And then it builds that strong bridge that we have to hold up our upper body with.
And our typical hold on a fascial release, 2 minutes, maybe a little more. We just kind of look for a nice kind of release. If we look at the leg, we can see there's a redness forming. We can actually feel some heat that comes off as the fascial tissue releases. That's one way that I like to start working on the side leg, then basic skin rolling. Again, just another way to get in and release some of that superficial tissue before I move around and do a little stretching. This is not always comfortable. Skin rolling can be a little bit testy at times, so I'd have to listen to the patient and see what they're telling us.
If it's really tight, it's a little more painful, and if like my leg's not that tight, it doesn't hurt, it just feels great.
So then, an easy way for me to stretch this, I can stretch it right from here. Just a little bit of adduction to the hip. How's that feel?
Nice.
If we're doing a true muscular stretch, I like 30-second holds or more, and it has to be comfortable. And 30 seconds is a long time. So when you're doing your stretches at home, you have to realize that. Long and comfortable.
All right.
So for that stretch, I've got to move back. There's just another angle I can choose. That'll pull more behind the knee, typically. How's that feel?
Super good.
And then from here, we can move into more of the glute muscles that Dave was talking about. Piriformis. How's that feel?
Fabulous.
And all comfortable 30 seconds.
Give you an hour to quit.
All right.
And I like to do a couple mobilizations to loosen up the hip. And so I was going to show you on Greg. Just lie on your side and face this way. So one of them is to stretch out the hip capsule. And so what we do is we use the ball as a lever. So I will roll them up to about 90 degrees. I'll put the ball up high in between the legs. And I use it to then create a force through his hip. So I'll support his lower cheek with my hand, and I'll push this femur or this thigh bone straight back to the butt, and we stretch his hip capsule. And this one is a 90-second hold or longer because the hip capsule is super thick and will not really start stretching until about 70 seconds. So after 70 seconds, we might hold it a minute or two, and that's where we get the most bang for the buck, is out in that second or third minute. So another stretch that I'll do is I'll do a belt stretch where I take line back and I'll do it from this. So I then work on creating internal rotation, which is generally the motion we lose the most in the hip. So a lot of people, especially men, will have hips that maybe have 5 degrees of internal rotation, and we really need 30 or 40 degrees. And so you have to increase that all the time here at the clinic. So I'll get a belt to create traction in the joint so that I can get that hip to relax. And I get them at a 90-90, and I grab that IT band that we were working on, I get my hand underneath it, and I use my hips to counterweight that, and I create a stretch while I slowly go into internal rotation or pulling his foot out, and I'll hold that again for 70 to 90 seconds minimum. You get that nice stretch. You okay?
Yeah, use it.
That's pretty good,
Help
actually.
a little bit, but I could use a lot more.
Yeah, it does feel good, doesn't it? So even though it's a little bit of pressure and tension, it really feels nice. So us middle-aged men appreciate that hip mobility. What we'd like to do next is just show you the things that you can do on your own at your house.
So, since I'm right here, let me show you some of my favorite strengthening exercises. So sideline, first one called the clamshell.
Feet are going to stay on top of each other. We're simply going to lift that top knee off of the bottom knee. I like a 3-count hold, 2, 3, and this is working abductors, which is often the weakness area when we have an IT band problem. Another one, which is a little more intense, you get the legs straight, true hip abduction. Again, I like a 3-count hold, 2, 3. Typically, I like to start 10 reps, but as you're stronger, we'll just add repetitions to that.
Yeah, good. The next muscle group that we like to work on is this higher glute, the gluteus medius and minimus. And if I tuck in my shirt, you'll be able to maybe see how that works. So what you do is you toe in, which isolates that muscle group. And as I'm towing in, I want to push back at about 40 to 45 degrees. And all I'm doing is lifting my leg and back down, lifting my leg and back down. And same thing, you go up, 2, 3, down, up, 2, 3, down. And again, we start with maybe 10 or so of those. I'll work up to 90. I mean, we like to get people really working, so I'll do maybe 3 sets of 30 as they're more able to. So,
Good. So then, home stretching, my favorite, which is not completely specific to the IT band, but it's a great hip stretch. Most people would refer to this as a performance stretch, just bringing knee towards opposite shoulder. And we're just looking for a nice pull in that glute.
The IT band is tight, tensor's tight, you're going to feel this in there as well. So this is just a really good stretch. Now one little tip here.
See the leg I'm resting over? Once I get my stretch, now if I just push that knee out, ooh, I can change the whole dynamics of the stretch. So that's just another tip to get yourself a better stretch. So we would instruct you in all these things, and this is what you would do at home, because it doesn't matter how good we are here, you're not here as much as you're not in here. So you got to do stuff at home. That's my favorite stretch right there.
and then for the more distal part of or the more inferior part or distal part of that IT band complex, it comes down and attaches both to the knee and down to the fibula. And so to get that portion, we have to somehow flex the knee and try to rotate it. So I'll put people in side lying on the affected side. So if this is my tighter side, I'll grab that foot, I'll bring it up to my upper cheek, which creates a little rotation, and I'll stabilize. And then after I'm in this position, I'll have them contract their glutes if they can, and then suck in their navel. And so if you rock your hips under and pull that up, that's pretty darn intense stretch. And that's all going to be coming down the outside of that leg and getting more of that distal or inferior part of that muscle. After I'm there for a bit, I can do a little contract relax where I do a little push where it looks like I'm trying to straighten my knee, and then I relax and hold, get a 5-second on, 5-second off, a little bit of push, and a little bit of relaxation. So those are the really good, consistent ones. We were talking about the very difficult muscle to stretch is that high IT band. It's not easy to create a lever between your hip bone here and your hip bone here. And to stretch that, Greg and I have fooled around and talked about what are the best ways to go, and there's really not a best way.
So if you look on the internet, IT band stretches, I guarantee you'll see this. They'll either be standing and pushing one hip out to the side, or if they don't think that's quite enough, then they'll step over that leg and
Try to push that out to the side. There's some problems with that. My biggest problem with that is that really jams up my knee. I don't get a good stretch without creating some discomfort in my knee. So I don't like that.
We try. Sometimes people feel it, so we'll use it. It's very independent on the client. They can grab a wall and hold onto the wall and then push that hip out and try to change positions, and that can sometimes get that to work. But that high IT band, there's lots of folks who give you stretches for it because there's not one really good way, so there's lots and lots of ways to make it happen. So those are the things we wanted to share today on hip stretches and strengthening that you can do at home and things that you might see here at the clinic. Thanks.